were past the peak. And that guess was Professor Carol Sikora, CMO at Rutherford Health, founding Dean and Professor of Medicine at the University of Buckingham, and ex-director of the World Health Organization Cancer Programme. And I'm very pleased that Carol Sikora is back with me this Sunday morning. Good morning to you.
Good morning, Nigel.
Well, your prediction of us being past the peak, I think was pretty accurate, really. It really was. On the basis of that, is it right that lockdown is being eased to quite a significant extent tomorrow?
It is. People are nervous. We've been brainwashed by a very effective programme by the government to really protect the NHS, stay at home, all the rest of it, save lives. And it's classical brainwashing techniques. And some people are really profoundly disturbed, I can see. You just need to look where I live. You go out and look in the supermarket queues. People, especially older people, they're very frightened indeed. And part of lockdown is going to be psychological, to try and get people out of it, to become normal again. Forget the new normal, it's the old normal. We've got to go back at some extent. At the same time, we've got to monitor what's going on. And our monitoring in this country has been poor when we this is testing, compared to many other European countries, and certainly to Singapore and Korea and even China, who started this all off.
So in a sense, we are easing, car showrooms open, quite a lot of primary schools opening tomorrow, all the rest of it. But it would be so much better, wouldn't it, if the test and trace programme was up and running and fully in place?
It would, and quite frankly, I think it's shambles. I mean, yesterday, the key question that was asked by a member of the public to the minister that was presenting yesterday, how will I know if a contact tracer phones me it's not spam? And there was sort of a bit of shuffling of papers. We've got processes in place. And what are the processes? And there was no answer to that.
No.
And I think that's the key thing. We're all used to spamming fraud for bank accounts. This is open to complete abuse. I could have a call now from a contact tracer. I've got to go into isolation for 2 weeks. I ask, well, who did I contact then? I can't tell you because it's anonymous. So how do I verify this?
I know. And the potential here for all sorts of scams and abuses too. Now, looking at the excess death figures, it would appear that we are the second worst country in the world in terms of death per million. Are we? I mean, cancer. I know cancer is your absolutely, specialist area. Is this right, that cancer diagnoses are down by about 70%?
Absolutely, and that's really why I started right at the beginning, trying to say that the government strategy is throwing cancer patients under the bus, and we've got to protect them because there could be more deaths from cancer. The problem with COVID deaths is that the way we're counting them in this country is making them seem worse than they really are. And in fact, when you look at the daily death rate at the moment, it's actually lower than average. Every day, 1,750 people die in the UK. At the moment, the rules were changed about 6 weeks ago into this crisis to allow a single doctor to certify death without seeing the patient for 4 weeks, which is unusual. And a lot of so-called COVID deaths, I've certainly had patients with cancer that were expected to die, but they'd been labelled as COVID deaths. And so we're seeing an exaggerated proportion compared to Germany, which has the lowest death rate, which is doing it in a very scientific way.
But we can't avoid the fact that excess deaths are, much, roughly 60,000 excess deaths in total.
That's what it's going to end up, I'm sure. When we get to the end of the year or to September, we can look back and we can see in April there was a peak, in May it carried on, and now it's going right down. And the doomsday people who say, well, it's going on, some of these, there were 212 yesterday, some of those would be from other illnesses, and would have happened roughly at the same time in the same place. So it's It's very difficult, this. And as we come out of it, we can look back and actually collect the data. And I think it'll be about 60,000. The problem is if we don't get the NHS started again for cancer, heart disease, mental health, and all the things it does, we'll be stuck with more deaths down the line from those illnesses. It could be more than there were from COVID itself.
Yeah, no, that's a very, very powerful point. Now, finally, I must ask you this, because Donald Trump has been deeply critical of the World Health Organization, its handling of this crisis, its attitude towards China. And as you know, he's announced on Friday that the USA is pulling out of the WHO. And as somebody that's been, the director of the WHO cancer program, I'd like your reaction to that, please.
So I'm saddened by it, because although the WHO does have some problems, it's heavily bureaucratic, it's political correctness gone mad. I really enjoyed my 2 years there. There's some very good people in there that know what they're doing about infection control. I had a fascinating time going to all sorts of places, and I realized that with cancer, the problem's the same everywhere. Rich, poor, east, west, it doesn't matter. The problem of treating it in the best possible strategy is what they can advise on it. Cutting the budget, America is the biggest contributor, $415 million a year. It will suffer because of it. Programs will have to be cut back, staff will have to be reduced. And, the sad thing is some of the work goes unnoticed. Dehydration in children in sub-Saharan Africa. It saves lives every day for probably less than $5 a life. It's the most effective health intervention in the world.
But of course, if it reforms, I know Donald Trump, and if it reforms, he will announce that America's rejoining it. Is it capable? You said yourself that it's overly bureaucratic, its political correctness gone mad. Is it capable of reform?
It is. Every organisation can be reformed. Reform was the talk when I was in it 20 years ago. The idea we were going to reform it, we were doing it, but the reform became a bureaucracy of its own, and everyone was writing papers on reform. There's a great temptation in public systems, as you know, Nigel, to write a paper is the end point of the piece of work. It's the implementation that's the end point, and that's just forgotten about, or passed down the management chain to some lower person to implement it, and they can't do it. It's the culture of the WHO. It's a Geneva-based organization, but has global reach. It's the only international health body that has 196 countries joining it. Everyone will do what it says. In the pandemic, what it made the mistake of not issuing didactic advice to government. This is what we do. Social distancing, hand washing, face masks. Let's get just clear-cut statements. It doesn't matter really whether they're right or wrong. Let's get consistency across international borders. And they didn't do that. They blew it. And plus the fact they were cozying up to China at the beginning, which annoyed Mr. Trump considerably.
Yeah, well, that certainly upset Mr. Trump. Carol Sikora, thank you very much indeed for joining us this morning. Well, a very positive message there from Carol Sikora, that we have to get back to normal, and we have to get the NHS back to normal, or as he said, even more people will die in the longer term of heart disease, strokes, cancer through lack of diagnosis at this stage than even will die of COVID-19. That's his view. Let's go to Ryan in Portsmouth. There's a new caller. Good morning, Ryan.
Morning, Nigel.
Morning.
I just wanted to make the point. I actually live in Southsea, a few minutes from the beach here. And,
yes.
Normally I go for a nice social distance walk in the morning, but I'm unable to now because
it's mobbed.
It seems like the relaxing of lockdown has just meant that we've got queues of people on the beach. You've probably seen it yesterday on the South Coast. There's no social distancing at all. I've got some major concerns of how the government are handling this. No face masks. And my argument is, if we have to socially distance, and we're not social distance, surely wear a face mask. So it just seems that, we're handling it very different to other countries. So I think it's quite evident on the beaches.
Do you feel, Ryan, that there's a lack of clear, understandable messaging coming from government?
I think, the message has changed. It changes when, it has to, for the government to look good. I think there needs to be some real strong leadership to say, okay, this is what our expectations are, and this is what we need you to do. It needs to be clear-cut messaging, and it's not clear at the moment.
No, I agree with that, Ryan. Thank you very much indeed. It's bonkers, isn't it? Oh, social distancing or gatherings of groups will change from Monday, ahead of a beautiful sunny weekend. I mean, it's a very, very odd way to do it. Sally in Barnet agrees and says, lockdown is so inconsistent. Meeting your kids and grandkids, yet you can't give them a cuddle, while all the while our beaches are packed and still planes come in and nobody is checked. Now, Laura from Essex says we need to get back to some sort of normality. I can't believe social distance is continuing. We should be discussing the fact that millions will lose their jobs and livelihoods, but that doesn't appear to be important. Laura, if we were to completely end social distancing and say it's a total free-for-all, then, Laura, I ask you, wouldn't the risk of a second huge wave be even greater? I am all for this easing. I accept there's risk with it. I wish the test and trace was in place, but I do think let's ease, but let's do it sensibly. That's my view.
We will make America great again.